We got a 58-year-old dude. He's got 6-month history, increasing difficulty buttoning his shirt, occasional cramps in the hands, tripping while walking. Starting his right side, it's now both sides. He denies any sensory, bladder, or visual issues. He's got wasting in the hands, hyperreflexia in the lower extremities, a brisk jaw reflex. He's got plantar reflexes, Babinski bilaterally, fasciculations of the tongue. Sensory exam shows no abnormalities. This is very bread and butter textbook ALS, amyotrophic lateral sclerosis. There's two things that you're going to see in 100% of USMLE vignettes. Make this very clean and easy, okay? Number one, the combination of UMN and LMN findings. That's one thing, okay? So UMN, we've got hyperreflexia. Okay, you can say hypertonia as well, which we don't have here. It doesn't matter. Babinski sign, UMN. Clonus, which we don't mention here, is UMN. Okay. Lower motor neuron findings. You could say hypotonia, hyporeflexia, fasciculations. Fasciculations, pass level LMN, Babinski sign, pass level UMN. Okay, got the brisk reflexes here, hyperreflexia. So this is all UMN. Wasting can be LMN. The point is we have a combination. Harped on it. Second thing, no sensory abnormalities. And this is really key because there's some difficult questions, especially 2CK and BME material, where you'll get a big 12-line rambling paragraph, no idea what's going on, and they'll say there's some sort of sensory issue in one of the sentences, and you're like, cool, not ALS. Okay, so let's just whip through the answers. What are we going to see for ALS? Autoimmune demyelination, peripheral motor, axons, wrong fucking answer. Difficult, because this could be GBS, Guillain-Barré syndrome. Okay, it can also be chronic form, CDIP, but this is going to be classically when you have an infection. They don't have to give you the dude went to a barbecue and had Campylobacter. They can just say 24-year-old dude out of nowhere, he's got ascending paralysis. They'll say he's got weakness in the lower extremities, proximally and distally, and in the upper extremities, only distally. That implies it hasn't ascended yet in the upper extremities. Okay, and they can give you decreased reflexes as well. ALS is not considered autoimmune. It's considered multifactorial neurodegenerative. There's many etiologies if you look it up. They could say it's increased GABA transmission, excitotoxicity of neurons. It's thought to be also be due to oxygen free radicals. There's a genetic component, 5 to 10%, SOD1 mutations as well. USMLE doesn't go there. They don't give a fuck. I'm just telling you for the sake of why A is wrong. Okay? Wrong fucking answer. Choice B, degenerative changes in the anterior horn cells, lateral cortical spinal tract. Correct answer. Now, if this seems weird, well, what's UMN? UMN is upper motor neuron that runs from the primary motor cortex down to the anterior horn. So lateral cortical spinal tract would be your UMN degeneration. LMN starts in the anterior horn of the spinal cord, and then the neuron's going to go all the way to the muscle. Now, you can get degeneration of the peripheral motor nerves as a result of the changes, the degenerative changes in the LMN component, but it's not autoimmune, and it's not axons specifically. It'd be more of an indirect effect, axonal changes. So let's just whip through the final answer choices here. Choice C is tetanus. Okay, so you're going to have tetanus toxin, and that's going to inhibit GABA and glycine release from presynaptic terminals, causing spastic paralysis. Botulinum toxin, it's going to prevent acetylcholine release from presynaptic terminals, causing flaccid paralysis. But tetanus, they'll give you the classic demographic, not just some dude cutting his finger on a rusty nail in the backyard, but you got to know neonates. I'd say that's the highest yield presentation for USMLE. Neonates, where they said kids born at home, umbilical cord was cut with a kitchen knife, tied with twine, and now has an arched back. Okay, so opsoclonus, and that's just tetanus. Wrong fucking answer. Choice D, loss of dopaminergic neurons, substantia nigra pars compacta, very easy one to eliminate. This is Qbank, you get like 1%, choose it. They'd be fucked if they chose it. That's obviously Parkinson's disease. Okay, so bradykinesia, akinesia, cogwheel rigidity, turn on blot, and there's a lot we can talk about. I'd say the pharm, important, carbidopa, levodopa. USMLE wants you to know that can cause psychosis in high doses. It's high yield on psych. I'll tell you, a dude was started on carbidopa, levodopa, has all of a sudden auditory hallucinations, don't discontinue it, just decrease the dose. Wrong fucking answer. Choice TNI repeat expansion cerebellar degeneration. Probably like, what's this referring to? Frederick ataxia. So GAA for taxin gene. And that's going to be not just ataxia, but it can be cardiomyopathy, MSK changes, pes cavus, high arch foot, scoliosis, increased proclivity for diabetes. Wrong fucking answer. You know the deal. I'm to make more content. I'm so discriminatory. Appreciate your time. That's it.